Hi, this is Dr. Gulani. So it's about 7 p.m. at my institute here today, and we had many of our radial keratotomy cataract patients flew back for their second eye. And I promised them that I will review how I think about the lenses and what really a toric lens does, and why that is my very powerful choice for cases with radial keratotomy cataracts. So here we are. I'll be brief, and then tomorrow again I'll share with you for sure with various diagrams and illustrations of how I plan. But here's a basic concept for you. So all of us, this is your eyeball, all of us are born with an absolutely clear crystalline lens, which is soft as jelly and crystal clear. Over time, with age, it becomes cloudy, and now it's called a cataract. All right, so that cataract sitting right here in your eye. This cataract can be easily removed with technologies that we have today within minutes with just numbing drops, and replace it with an intraocular lens. Remember, your cataract was a lens to begin with. So we replace it with a lens. Now this lens category is called a basic lens category. It has no additional features, no astigmatism correction, no distance near, maybe a focus either for distance or near, and that's it. So that's a basic lens implant, and it sits right there. So the lens, as you can see, is sitting in the bag which was holding the cataract, which is called a capsule. Clear? That's a basic lens. Now, when these lens implants have additional features where you can see distance and near, and have most of the distances in between, they may be multifocal like this, trifocal, bifocal, progressive, small aperture. They can be extended depth of focus, various levels of additional features, and that's then called premium lens implant. Got it? So premium lens implant is more than a basic lens implant with these features that help you see at different distances and improved quality of vision. Now, if you take the premium lenses and raise the bar on them and add an even more powerful feature to them, that's a toric lens. So premium lenses of all kinds, which give you different kinds of visions at distances with great expectations, also can have toric, meaning astigmatism in it. Now guess what every RK cataract patient has? Astigmatism. Now, for a doctor to use a lens implant that has toric or astigmatism in it is very complex, much more complex than using a basic or a premium lens implant, because not only does this lens have to be accurate in power or prescription, also has to be accurate in placement in the eye. It has to be, if you see these dots here on the lenses, right there, the dots have to be aligned to a certain degree axis inside your eye, in the bag that was holding the cataract. So imagine the level of precision. Not only have you got to be right again in the spherical power, whether you're nearsighted, far-sighted reading power, also has to be correct in axis. If you're missing the axis, you'll cause double vision, streaks, halos, all those problems. So this using a toric lens requires tremendous confidence, requires decades of experience, requires surgical skills that is to the finesse at a level that the lens has its maximum potential. And in radial keratotomy eyes, which already have a difficulty level of measurement, that's where many doctors avoid premium technologies or may use lenses that needs to be adjusted after inserting once, twice, thrice, or even more than that to finally get to a correct number, or have to exchange the lens. Instead, with very high confidence, a lens implant can be put in to be accurate, even in radial keratotomy eyes where measurements are different or difficult and even change. Right? So my choice in cases of radial keratotomy cataracts is to give that level of confidence to my patients, to take the onus on my shoulders, to not just put something in and then adjust it later or exchange it, but actually go in with full confidence, perform the surgery at a level, no matter how complex your radial keratotomy is, and then use a lens that I have to be so accurate in not only the power, but also placing it on the axis, despite your cut corneas and scars and everything that goes on. So tomorrow I'll show you some illustrations, show you how the lenses are sitting even in 40 cut radial keratotomy cataracts that I have taken care of. So that's why a toric lens is ideal for radial keratotomy cataracts, but does require confidence, experience, and surgical expertise. All right, I'll share with you more tomorrow. Got to go home now. Dr. Gulani.